tell.
All right, I've got this going now. So, all right, Dr. Cangiano. So I know Rob's showing you some of the questions already, so hopefully these don't come as much of a surprise to you. But just to start with, I guess the first question is, until your adoption of blue light cystoscopy, what approach or approaches have you typically relied on for diagnosis and the management of your bladder cancer patients?
Well, typically we relied on white light cystoscopy to look for any lesions that were out of the ordinary and abnormal. So that includes anything that is red or velvety, any kind of lesion that doesn't look like typical bladder, papillary, raised. So typical white light cystoscopy was done prior to blue light, and for many years. And the background I have is I actually had one of the reps from the blue light, the CysView, come into the office and talk about it, and I was really interested in it because I've heard about it, and I've heard about it used in other applications, but not necessarily, didn't know whether the data really existed for the bladder and increased detection. And as I researched more, I looked at some phase 3 trials that, showed the increased detection of carcinoma in situ and papillary tumors in patients undergoing white light cystoscopy versus blue light. And then when I went to the American Urologic Association, it seemed like many of the academic centers and, centers of excellence were all using blue light cystoscopy as part of their algorithm in detecting more of these tumors. So, I kind of pushed hard here at Altamont to adopt the blue light as one of the techniques and tools to use to help, diagnose these tumors in our patients.
Great. Yeah, so that definitely answers our second question about how you learned about, blue light cystoscopy. But since you've actually adopted it within your practice, has the technique satisfied your initial expectations of the blue light cystoscopy procedure?
Yeah, I would say it's been a learning curve, because we were just talking about before you were on the line that, there's some patients who have inflammation in their bladder. There's some patients who have other conditions or been treated with chemotherapy or BCG. And so it's not really a false negative, but the intensity of fluorescence is what's really impressive when you see a tumor like a CIS or papillary tumor and then some satellite lesions you may not see in white light cystoscopy that you catch with the blue light. So the blue light helps, not only just detection, but also helps you visualize what I call the root of the tumor and how deep it goes. And that's really important, because we didn't really have anything to assess that. As we go in and resect these tumors, all you see the tumor itself and the surface, and you see the muscle, and as you go deep, you don't see what's deeper. So in my impression is it's like a weed. The weed has roots, and if you don't get all the roots, you're not getting everything.
Great, that's a great analogy. And so since you've adopted blue light cystoscopy, how have you within your practice made your patients aware of that you use it within your practice, and also are you actively promoting it within your practice to the patients?
Right now we're not actively promoting it, and that's coming soon, but we are making them aware. We have little cards that the company gave us that talked about blue light and those patients who are undergoing the procedure. So apparently there is going to be some marketing that I've been discussing with the head of the OR here for Altamont as a service to the community, as a service to patients who have bladder cancer. So that's in progress right now.
Excellent. And to date, have you had any patients actually come in asking for this, or have any of them been aware of this procedure prior to coming to see you?
No, most patients are unaware,
right.
And we talk about it at the time of consultation and the time of cystoscopy if something's found.
Right, yeah. We haven't done, any real, too much direct-to-consumer marketing, so that's definitely something coming down the line. And have you had any patients come from outside of your geography to come actually get treated with blue light cystoscopy, since it's not readily available in every, hospital out there? Have you seen any come kind of from out of the geography to come see you?
Not yet. I think, once again, we're still in the initial phases of, this is going to grow as we move forward. So that has not happened yet. And I suspect as we move forward and do, marketing and get the word out and make this known in the community that we have this technology, you're going to see people come out and want potentially more either opinions or second opinions on their situation, whether they're candidates for this or not.
Mm-hmm. Good, great. And obviously blue light cystoscopy, the procedure itself is different, and the steps that you take are different from white light. So in terms of how it's affected your practice overall, can you tell us kind of in terms of workflow, and also in terms of the clinical pathway and how you manage your patients? How has that changed with blue light cystoscopy? Or has it, impacted you at all?
Well, it hasn't really changed. It hasn't really changed the workflow. There is a little learning curve with some of the equipment with the staff and myself. But once you get over those hurdles, that's not an issue. So it hasn't really changed the workflow significantly.
Oh, that's great to hear.
I think what it does is it makes you, what it does and what it's meant to do is help you detect tumors you won't see on typical white light cystoscopy.
Mm-hmm. Yeah, exactly. And in terms of patient outcomes and satisfaction and patient satisfaction, use of blue light cystoscopy with your patients, how has that kind of impacted patient outcomes and patient satisfaction since adopting blue light cystoscopy?
I think patients are very, very satisfied. I think patients are very interested when you have the conversation with them about this chemical that's going to be placed in their bladder, and it's going to help the doctor see the root. And that's how I really put it. I say I want to see the root of the tumor and where it goes. Mm-hmm. So I think the patients are very accepting of this, and they understand these tools and this technology, is relatively new, and they understand that it's going to help me help diagnose their disease.
Right, and kind of just ties in with this last question, but are you able to offer kind of more details on how it's impacted your patients' quality of life, the ones that you have treated with blue light cystoscopy? Are they sharing that with you, or are you seeing improvement in quality of life in general?
I think that's honestly it's probably yet to be seen. My understanding of the studies show there's really not any difference in rate of progression, but in terms of detection, in terms of full complement of resection, there's no doubt it's much better. In terms of overall recuperation, I don't see any difference. I don't see really any difference in that regard.
Right, okay. And I know it hasn't been that long since you adopted the blue light cystoscopy within your practice, but based on your experience so far, have you seen, lower recurrence of bladder cancer within those patients? And also, are you seeing an increase of number of patients who are now cancer-free? At this point in your experience?
I can't say at this point,
okay,
because it's been, we've only been doing this for the last 6 weeks probably.
Oh, okay, right? Got it. 8 weeks. Understood. Yeah, I didn't realize it was that new. So
it was after the AUA. I came back to the AUA. We talked about it. We did a couple cases. So it's been a few months, and I can't say that I've seen necessarily an impact. I think what I've seen is probably what it's done for me is the biggest impact is help me stage their disease better. And if I can stage their disease better, I can treat them better.
Perfect. Great. And just a couple more questions, and then we'll let you go here. So what other advantages, other than clinical benefits, which you've already expressed in being able to stage the patient and treat them, better and treat them properly, but have you seen any other economic advantages or economic impact at all? For example, are you anticipating like a lower overall cost of care to take care of these patients? Is this something that you would anticipate in the long term? Or any other advantages at all?
I would. I would, because I think if you're able to resect everything, and you're able to resect the deeper roots and see those, that your impact should be positive in the long term, because you're going to save that person from recurrences. Now, I understand these phase 3 trials didn't show necessarily all that, but in my mind, if you're able to remove the entire lesion and not leave a root behind, their risk of recurrence has to be lower. It's the data will show that later on. I think it's going to take a while to understand that, but probably that's what's going to happen. You're going to see a lower risk of recurrence in patients treated with blue light versus white light.
Right, and I guess naturally that will have an economic impact as well on the healthcare system and taking care of those patients.
Yeah, I think you need more power of study. Like you need more patients, and if you have more patients, that's when it's gonna come out. So I'm sure it's going to happen. It's just going to be a matter of time,
right?
As these patients are followed more longitudinally.
Right, and that's our hope. So,
all right, can we do what? Can we go ahead and wrap up?
Yeah. So, just the last question is, in your opinion, I guess, how could we further improve the overall continuum of care for the bladder cancer patients? Like, for example, is there something that we could do to improve the blue light cystoscopy system that would drive better outcomes and patient satisfaction and help you within your practice? Is there anything that on top of mind on that? As far as what we can offer in addition to kind of what you're doing right now in the office, I mean, we do have flexible now blue light cystoscopy that can be done in the clinic setting when the patient's awake. So that's kind of what I'm driving towards, to see if you have any thoughts on that.
Yeah, that would be really helpful, because we scope a lot of patients with white light. We don't see anything, and their cytologists come back positive. Or the other, you scope them and you don't see anything, and they come back 3 months ago, but 3 months later, 4 months later with a lesion. That was there before, you didn't see it. So yeah, it would be very useful in the office if not cost prohibitive.
Right. Okay, well, thank you so much, Dr. Cangiano. Anything else to add before we wrap up?
No, I'm very okay. Thank you.
Thank you so much for your time. Take care.
You're welcome.
Bye.
All right, thanks, team. I appreciate it.
Thank you. Have a great day.
You guys have, thanks, Dr. Cangiano. Do you guys have any follow-up action for me to do?
No, Rob, that's fine for now. I think we're good. We were able to get through actually all the questions, so he did a great job, and thank you so much for pulling it all together. And sorry about the debacle with the recording there, but we have it now.
Okay, yeah, no worries. And sorry, I was kind of trying to prompt it along a little bit, but he works very quickly and likes to, he's kind of always on the move, so it's getting a little antsy there. So, but I'm glad it all worked out.
Thank you for being there and helping us out with this, and I'll follow up with you if there's anything else that we need for now at this point.
Okay, sounds good.
Thanks, Rob. Thank you, everyone. Have a great day.
Thank you. All right.
Thanks, everyone. Nice work.